I work for JSI Research and Training Institute, who has been contracted to serve as the Physical Activity and Nutrition Center of Excellence, the training and technical assistance provider for the CHSC grant. The goal of this webinar is to make sure all CHSC grantees are on the same page when it comes to talking about policies, systems, and environmental changes, otherwise known as PSEs. With this goal in mind, today we will cover the what, why, and who of PSE. So let's dive on in. The first question we'll cover is, what is PSE? PSE stands for Policy, System, and Environmental Change. A policy is a written, documented change. It includes the passing of laws, ordinances, resolutions, mandates, regulations, or rules. Policies can be written and adopted at the federal, state, municipal, or organizational levels. Policy examples include an organizational wellness policy that outlines standards for beverages sold and served, a written agreement that allows increased use of a school facility during non-school hours for recreation, and documented guidelines for food served in meetings, events, and celebrations. Systems changes are changes made to the unwritten rules or processes of an organization, institution, or community. These changes impact all areas of an organization, institution, or community. Systems change and policy change often work hand in hand. Oftentimes, systems change focuses on changing infrastructure within a setting or instituting processes or procedures at the systems level that support a healthier organization. Systems change examples include a healthcare referral system that helps patients access nutrition and physical activity resources, fruit and vegetable prescription, or FVRX, and prescription for parks, or PARK-RX programs are some examples of these. Other systems change examples include farm-to-school programs and connecting emergency food providers with local growers in a sustainable way. Environmental change interventions involve changes to the economic, social, or physical environment. Environmental change examples include adding sidewalks to a street, providing supports for physical activity like bike racks, and adding a hydration station at an organization. Okay, now that we've covered what PSEs are, let's test your knowledge. Is the following a policy, systems, or environmental change? Creating a certification process for school bake sales to ensure they are in line with the school wellness policy. What do you think it is? If you guess systems change, you are correct. A certification process for school bake sales to ensure that they are in line with the school wellness policy is a systems change because it is a change in processes of an organization. And in this case, the school is the organization. Okay, how about this one? A law allowing residents to plant community gardens in vacant lots. This is a policy change. A law allowing residents to plant community gardens in vacant lots is a policy change because it is a written and documented change. How about this one? Adding a bike lane on a street. What do you think this is? If you guessed environmental change, you are correct. Adding a bike lane on a street is an environmental change because it is a change to the physical environment. Okay, so this brings us to our next question. So why PSE? As I'm sure you know, health is complex. Per the social ecological model, we know that various factors influence health from individual behavior all the way to societal factors. Research suggests that most Americans believe individuals can control their own health outcomes if they make healthy choices, focusing on the center and the smallest part of the social ecological model, For example, heart disease and diabetes are often considered personal problems, where many people believe education, hard work, discipline, and self-determination are the solutions, not the conditions that inhibit people from using the education and skills necessary to engage in healthy behaviors. This view is like a selfie, a photo at arm's reach that fails to capture the surrounding environment. When public or decision makers have this individualistic view on behavior, they are not able to understand why solutions beyond education and behavior change are needed, the value of their involvement, or ways within which they can contribute to meaningful policy and place-based changes. To be successful in improving conditions related to nutrition and physical activity, we need to not only recognize that the surroundings shape and impact health, but what make what is often invisible, the environment, visible. We have to shift the message to creating healthy environments and place less emphasis on individual outcomes, and place more emphasis on the environment. The public, and especially decision makers, need to see the broader picture, which emphasizes the environment. To better understand this, let me tell you a story. There once were 3 friends who were out fishing downstream. Suddenly, they see a person coming down the river struggling for life. The friends pull them out. Then another comes, and again must be rescued. Then another and another. This happens all afternoon, and the friends are getting very tired from constantly pulling people out of the river. While 2 friends continue to help people, one friend decides to walk upstream to see what is going on. When they arrive, they find that people are drawn to the edge to look at the view, but there is no safe way of doing this, so many of them fall. This friend quickly runs to their truck, where they happen to have a big board and some spray paint. They spray a sign warning people of the edge of the cliff. While some people continue to fall in the river, the number has drastically decreased. This is good, but not good enough, as some people are still falling in. The friend heads back downstream and informs others of what's happening. Together, they go to the community leaders to inform them that a number of people are falling into the river because there's a lack of a protective barrier on the cliff. The community leaders then build a gate behind which people must view safely the water. This story highlights that the differences between programs and policy and environmental changes. Instead of spending all resources on a program that rescues people once they've fallen in, or educating people that it's not safe, it is important to change the environment to make it safe to view from the cliff. This is not to say that programs are not important. They are, and they will certainly help people. But in order to help more people and prevent it from happening in the first place, it is important to change the environment. I'd like to put this story into perspective. Okay, so everyone listening on this webinar right now, take a moment to think back when you were 7 years old. Which of the following were true for you? Did you frequently ride in a car in a booster seat? B, frequently ride in a car without a seatbelt? Or C, frequently ride in a front seat with or without a seatbelt? Depending on when you grew up, your answer was likely greatly influenced by a number of policy factors. As you can see here, cars weren't mandated to have seatbelts in their design until 1965. So anyone raised prior to then likely drove without a seatbelt because cars simply didn't have them. In 1984, New York State was the first state to mandate people to wear a seatbelt. So if you were raised prior to then, you may or may not have worn a seatbelt even if your car had one. And I guarantee you, for kids these days, driving in New York State, they're most likely wearing a seatbelt, and not only because the policy requires it, but because most cars, or all cars rather, have them. This timeline shows how comprehensive efforts are important and that policy change takes time. These examples reflect a framework called the spectrum of prevention. Although all levels play a role, you get the biggest return on your investment when focusing efforts on the bottom of the pyramid, influencing sectors and changing organizational practices, both of which can be done with PSEs. So we come back to our question, why PSE? Well, if I haven't convinced you yet, a quote from the U.S. Institute of Medicine summarizes it quite nicely. It is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. In addressing the social, cultural, and physical environment through PSEs, we work to address the root causes of health, which some of you may know as the social determinants of health. These root causes include transportation, employment, housing, food security, racism, classism, ableism, and sexism, among others. This table helps to showcase the difference between the traditional individualistic approach to public health that focuses on programs and events versus a transformational PSE approach. Take the community setting in row 2. To get community members moving and more active, a traditional public health approach would be to host a walk to school day event. By contrast, a more transformational PSE approach would involve implementing a complete streets policy to ensure community roads are constructed for safe biking, walking, and driving. The same goes for the worksite example in row 3. A traditional public health approach to promoting employee health would be to hold a health screening for staff. By contrast, a transformational PSE approach would be to implement healthy vending machine standards that offer healthy snacks at an affordable price. To summarize, traditional public health focused on the individual, educating them during a limited touch point like a program or event, which often, if successfully implemented, resulted in short-term behavior change. By contrast, transformational public health embraces policy, systems, and environmental change strategies, and in doing so, produces longer-term and more sustainable behavior change over time. I want to reiterate that transformational public health in focusing on PSEs does not advocate that education has no role or place. As you can see here, policies, systems, and environmental changes are all connected and enhanced by education through practice and programs. Okay, so this brings us to our next question. Who is involved in PSE? Well, really anyone. Diverse organizations can implement PSEs. As you can see listed here, they can include governmental bodies, school districts and schools, parks, healthcare organizations, work sites, and other community institutions. When working with these organizations, it is important to keep in mind that PSEs are only successful to the degree that they are community-driven and community-led. In other words, the degree to which PSEs are owned by the community. This image shows the spectrum of community engagement to ownership as presented by facilitating power. The spectrum moves from ignore on the far left, in which the community is marginalized and not involved at all, to inform, consult, involve, collaborate, and ends on the far right with defer to, in which there is full community ownership. Your work must strive to achieve the right side of the spectrum, meaning your role as a CHSC coordinator is not to implement PSEs for or on the behalf of a community or organization. Rather, it is to facilitate a process such that the community members have full ownership of the planning, implementation, and sustainability processes with full decision-making power throughout. You may be asking yourself, so what does this mean? If you take a close look at this image, true community ownership means to advance equity. And the question thus becomes, what is equity? To understand equity, we must first understand equality. This image shows two communities. The community on the right has many assets: a school, buildings, a hospital, solid housing. The community on the left has no school, no hospital, and buildings in disrepair. Equality here is a pipeline delivering equal resources to both. Equality being the exact same amount and type of resources. Think about what equality or equal resources would bring to each community here. Compare the equality image to the equity image presented here on the right. In the equity image, the two communities receive resources that meet their needs. The key here being the resources are tailored to meet specific needs. Now, both of the communities thrive. Given the number of disparities that exist across all sectors, education, health, employment, housing, transportation, food security, to name a few, for Black, Indigenous, and other people of color, as compared to white people, advancing racial equity must be at the forefront of your PSE work. This is not to say sexism, ableism, classism, or ageism, for example, should not also be considered and addressed, as they certainly should be. But racial equity must be explicitly called out and advanced. Heidi Schillinger, the founder and principal of Equity Matters, eloquently explains it here by stating, "Equity is the harder work of listening and co-designing solutions with communities of color. Equity is giving up or sharing power and privilege. Equity is getting off of your road bike and slowing down to build relationships and enjoy what people of color offer to the road race." In looking back on the equity image and thinking about racial equity, power, and privilege, some questions arise. Here, resources are being tailored to meet each community's individual needs. However, we could also be asking, who? Is it white, Black, Indigenous, or other people of color? Is controlling or has decision-making power over which resources and how much goes where? Who decides what happens to the resources once in the community? Who receives the resources once in the community and who doesn't? Even when community resources are reallocated equitably, why is there a divide between the communities to begin with? The U.S.'s deep-seated history of slavery and centuries of racially divisive policies and decisions have to be considered. How does that history, context, and existing realities influence the PSE work? In short, to equitably advance PSE change, you need to continually check who is at the table, who is not at the table, who is making decisions, who is not making decisions, in what context are decisions being made, who is benefiting from the decisions, and who do the decisions harm, among many other things. Let's take installation of a bike lane, which is an environmental change. In thinking back to the goal of achieving equity through community-driven decision-making, some questions you may need to ask include, who is at the decision-making table during the planning, implementation, and maintenance processes? This is absolutely where you should start. Are Black, Indigenous, and other people of color represented? People with disabilities, people experiencing homelessness, people with lower incomes, people of different sizes, people of different ages? What sectors do these individuals represent? Government, agriculture, education, community design, healthcare? Why is the bike lane being installed on one street in a community and not another? And being installed on the selected street, what does this mean in terms of who has access to the bike lane and who doesn't? Access also includes who has a bike and who doesn't, and what will be done for those who don't have access to a bike. What does the bike lane connect to? Does it connect from one neighborhood to a park? Does it connect people to a community destination? To that end, who does the bike lane benefit? Will certain organizations that the lane connects to benefit over others? Meaning you have to ask on the flip side, who will the installation of the bike lane harm? Maybe connecting the bike lane to one business area over another will cause another business to lose customers. And what does that mean? Who is funding the installation of the bike lane? Who will be responsible for maintaining the bike lane moving forward? Who will decide how the bike lane will be used? Will there be policies written to determine speed, utilization hours, and other things? There are certainly more questions to ask, but the key takeaway here is taking the time to ensure who is considered at all points and ensuring that those answering these questions are diverse community members representing various demographics and sectors. I want to take 1 minute to emphasize the fact that all sectors have a say in PSE change, regardless of what the PSE change is. Bike lanes, for example, can have an economic impact if it means people can more readily reach their place of employment or access stores. They can also provide jobs to people to build the lanes, supply the bikes, and maintain both. They may also impact the economy negatively by taking business away from the automotive industry. All of these factors need to be considered. Another sector, the education sector, may care about bike lanes if they help to advance safe routes to school. Parks may be invested if they help to advance safe routes at parks. More people on bikes reduces automobile pollution, so those invested in the environment would have a say in bike lane installation as well. Bike lanes may mean more people out in the community and an opportunity to improve social cohesion. So community organizations could be invested in bike lanes too. Parents may want bike lanes to reduce vehicle traffic and make a street safer for their children. So families too could have an interest in bike lanes. Many more sectors could and should be considered, but the takeaway here is PSEs require multi-sector collaboration. So when asking who is at the table and who is not only do you need to consider demographics such as race, age, gender, ability, but also sectors such as education, agriculture, business, housing, transportation, food systems, and more. Because of all of this, PSE change takes time. It can take months and more likely years to equitably advance PSE change because it is critical that you spend the time engaging with, listening to, learning from, and co-designing solutions with community members and sectors, all while assessing your power and privilege. As Heidi Schillinger stated, this all comes down to building relationships and embracing what people in the community, especially those who identify as Black, Indigenous, and other people of color, have to offer. Questions? Please feel free to contact JSI. You can reach us via email at pance@jsi.com. Thank you.